Rheumatoid arthritis is a chronic autoimmune disease that affects the joints, causing things like widespread joint pain and significant pain upon waking. RA is most prevalent in 40-year-olds and up, but it is not to say you can be diagnosed in your 30s as well. Usually people with RA have severe joint pain, muscular issues, reduced functional patterns, and impaired movements. But with that being said, exercise also can be used to help modulate and slow the disease and manage what you have. The major problem with the joints with RA is too many cytokines within the joint capsule, which is called the synovium. Cytokines, you know from COVID, causes a storm of inflammation. So people with RA have a very inflammatory joint. So these joints, which are all throughout the body, can be helped by doing mobility. So mobility routines, and I have been talking about for women with perimenopause and menopause, are exceptionally helpful for people with RA. I have many women on my caseload with severe RA, and these women are in their 7th and 8th decade in life, and these women are no longer on medications, but their disease has progressed to a different level. But the thing that these women all have in common is mobility routines, sauna use, and consistent slow movements, such as walking. Now, some of these women are doing high intensity exercises, which blows my mind, but it gives them joy and keeps them moving. People, when they first get RA, experience a significant reduction in muscle mass. Now, I suspect there is a chemical reason, but I also think that there is a long period of mobility issues and not being able to move because the pain, and they don't have the diagnosis yet, and the deconditioning comes from that. But once you have the diagnosis, you find medications that help you control the chemical inflammation. Next, we get to finding a daily routine that works for you. And it usually, like I said, involves low impact walking, a mobility routine, staying within your pain-free range. And if we do weightlifting, it is within your pain-free range. So what I advocate for in my patients is an early exercise routine to maintain and keep the mobility the best that we can and continue to move the joints, be respectful of pain and flares, and continue to make muscle bulk. Now, 2/3 of people with RA will have some significant atrophy because of cytokines and TNF factor, which means chemically they're having a hard time. But it does appear that there are some muscles that aren't as affected as others. For instance, the quads, your thigh muscles. The activation pattern doesn't seem to be as bothered with RA. So there are some muscles we can utilize more than others. And there are people, depending on what your RA affected the most, can do some exercises better than others. But the quads seems to be a small loophole in the system. So with my patients that are a variety of different people, different backgrounds, different ages with RA, the mobility routines can be a Pilates reformer. The Pilates reformer to maintain the range that you have, doing yoga, tai chi, qigong. Sauna 3 times a week is one of the greatest unsung heroes to help keep your joints warm and lubricated. But we are now also realizing that if we help you maintain your range early in the process and help you maintain your muscle bulk, we can help you live a comfortable life and have the muscle bulk you need. We know from research that some of the greatest impairments from RA is not just from the joint pain, but from the decreased muscle bulk and significant atrophy that occurs along the way. Research has also shown that high-intensity exercise can reverse that atrophy that comes on chemically from RA. Now, the complication is that some people's hands are significantly affected by the RA, so they are not able to hold the weights. Hence why a Pilates reformer using the arm ropes and looping the ropes around your forearm allows you to actually use the elbow instead of the hands. In some of my patients, their elbow is exceptionally restricted, and we're better off using the hands. So using the joint that doesn't bother you to gain that leverage is one of the ways that we work around. So the other thing that is not oftentimes talked about, because of the pain and sedentary lifestyle that some people adopt because they feel horrible, they now are at a higher risk for bone density issues. And if you pair that with significant steroid use, bone density is an issue. Now, this is why I use my whole body vibration plate for my patients with this. So I love to highlight how physical activity can help mitigate the symptoms of RA, but let this show that I firmly believe that RA is painful It sucks, it hurts, it's different in everyone, and each person will find their balance, but I hope you have somebody to help you on this journey to figure out what to do that works for you.